Lloyd Doggett from Texas. 77% of Americans are saying that skyrocketing drug prices are their #1 health concern in a survey that was done last month. For too many, a diagnosis of cancer or any other serious disease has become a prognosis of bankruptcy. Congress has not only failed to respond, many of our colleagues don't even recognize that there's a problem. Today, colleagues from key House committees are here to announce the formation of a new affordable drug pricing task force through which we are demanding action. All of us have heard about the company that took a 62-year-old drug and raised the price overnight by 5,000%, from $13.50 to $750 a tablet. But exorbitant drug prices are not about one wrongdoer or one drug or one class of drugs. They are a systemic problem that involve a wide range of manufacturers. Prices for the world's top 20 selling drugs are about 3 times higher in America than in Britain. Jim, if I may move you just a minute. For example, Nexium, $215 in the United States, $42 in England, $23 in the Netherlands. It's enough to give you heartburn. Runaway prescription drug prices not only threaten families with financial ruin, but they challenge our hospitals and they can wreck taxpayer-funded health initiatives. While enjoying both generous tax breaks and government-subsidized research, the pharmaceutical industry claims that it must engage in price gouging of Americans to fund research for the world's consumers. Innovation versus accessibility is really a false choice, and innovation means very little if cost denies access to new drugs. Instead of setting a new record of Obamacare assaults, this Congress ought to be looking at record drug prices. There are many legislative answers. We'll talk about some of them this morning. One place to start is John Dingell's Medicare Prescription Drug Price Negotiation Act, which this House approved in 2007 with the support of every Democrat and 24 Republicans. But the problem is much bigger than Medicare. Our colleagues will be working together and will outline some of their concerns this morning on full disclosure of the cost of drug development, price calculations, and medical expert evaluation of drug efficacy, especially of these highly touted and advertised drugs. Today we're calling on the House Republican leadership for action. We call on the administration as well to use every tool at its disposal to grapple with this challenge. In this regard, it's encouraging that yesterday Secretary Burwell announced that on November the 20th, she'll hold a major pharmaceutical forum. I think that's great. We need the talk, we need the input, but then we need the prompt action. Drug company manipulation of prices is threatening our healthcare system. There is a big difference between reasonable profits and profiteering. I'd like to call on colleagues who've worked on this issue and are asking for action. I'm going to call up first the ranking member of the House Ways and Means Committee, Sandy Levin. Sandy, excuse me.
Well, I'd like to congratulate all of us for setting up this task force. Some real progress has been made in getting a hold of healthcare costs under ACA. Hospitals, physicians, they are under schedules. And indeed, we're moving in some areas towards value-based and away simply from volume. The big hole is prescription medicines. There essentially are almost no controls, and it's kind of running wild. And the estimate is it will increase even more so by 41% within a couple of years. So we need to plug this hole. We need to build a structure that relates to prescription medicines. This is an emergency situation And so what Ways and Means Dems are going to be doing as soon as the new chair is selected, as early as this morning or today, we are going to send a communication to the new chair asking that there be hearings held within the Ways and Means Committee. So I just want to close by emphasizing how out of whack the system is because of prescription medicines. And if anybody has any doubt about this, go home and stand on a street corner, any street corner. You can take your pick and ask people, when it comes to health care, what is your number one problem? And many people will say the number one problem is the cost of drugs is ruining my budget. So this task force has this aim. We hope working on a bipartisan basis and with the administration, as I said, plugging this huge hole in terms of the healthcare structure of the United States of America.
Thank you, Sandy. I know you're off to a hearing. The issue of prescription price gouging may have slipped off the agendas of some, but it never slipped off the agenda of Jan Schakowsky, who has legislation dealing with this issue that she's filed and has been an active member in getting this task force underway. Congressman Jan Schakowsky from Chicago, a member of the Energy and Commerce Committee.
Thank you, Lloyd. I'm so happy to be part of this new task force that is going to be focusing on a problem identified by 77% of Americans as their number one health concern, and that is the cost of prescription drugs. It's really beyond unfair that taxpayers who help to fund drug development find themselves unable to afford the cost of treatment. But despite rising drug prices, we still have no information on how drugs are priced and what the true cost of production, the true cost of research and development really is. The cost of the production of a particular drug is hidden from view, and we are just left with estimates based on research, getting protected information, proprietary information from drug companies on the average cost of drugs. It's very hard to get that information, and we want to know what it is. This is no longer good enough. If drug companies are going to make the argument that they need to price these drugs at such exorbitant rates because of the cost of R&D, then they need to be proving it. We have the data on one such drug, as the evidence is clear that drug companies are taking advantage of the system and really ripping off consumers. Sovaldi, the new hepatitis C treatment that came to market this year, costs $84,000 for the cost of treatment. Now imagine, we finally have something that could cure hepatitis C. There's the cure. Oh, but you can't afford it. Who could? $84,000. And the drug manufacturer will tell you that this cost reflects investment made to develop the drug. But Gilead bought the company that owns Sovaldi for $11 billion and recouped that investment in 1 year. So if Sovaldi were used to treat each of the 3 million hepatitis C patients in the United States, that would cost about $300 billion, or the same amount that we already annually spend for all other drugs combined, despite the fact that it costs less than $1 to produce a pill. So we have an opportunity now to go back and take another look, for example, at what we did with the Medicare Part D program. Many of us who are here remember that the pharmaceutical companies wrote the language into the bill that said Medicare may not negotiate for lower prices with the pharmaceutical companies. This was a total giveaway to Big Pharma. It is time for us to look at the regulations around drug pricing, to get the information that we need, to have sensible rules that make access for ordinary consumers, ordinary taxpayers who are helping to develop these drugs, make those drugs available to them. And so I really look forward to having hearings in committees the work that the Secretary of HHS is doing to look into this issue. We need to get going and resolve this problem for the people of the United States. Thank you.
Thank you very much. A medical doctor and the ranking member of the Health Subcommittee as a colleague on the Ways and Means Committee, Dr. Jim McDermott.
Thank you very much, Lloyd, for bringing us all together. The issue here is fairly simple. The pharmaceutical companies have got the Congress in the palm of their hand, and they will not let us go. In 2003, as you heard Jan say, we gave them a guaranteed cash cow in Medicare Part D, saying that there could be no negotiation of prices. That means that the secretary who's negotiating for 45 million people can't ask for any reduction. Now, the Secretary of Veterans Affairs has gotten between 40 and 60% reduction in the cost of pharmaceuticals. Veterans get a better benefit than do seniors. But even worse than that, if you think about it, the poor people in this country in Medicaid, according to CBO, they did a study, and they said that seniors pay 27 to 38% more than the Medicaid program. Now, these are huge guaranteed profits to the pharmaceutical industry out of senior citizens. If we would allow one thing to happen, and that is change that ability for the secretary to negotiate, we could bring the prices down, because the rest of the pharmaceutical industry is dealing with private insurance companies, but they've always got this backup of all this money from the federal government. In addition, we gave them risk mitigation funds in case it didn't work out. We gave it to them 10 years ago, and it's still going, and they're making money hand over fist. One of the best stocks to buy are drug stocks. Look at all you have to do is go to the Dow and look. And this is an issue that has got to be dealt with. Now, I wrote a letter to my chairman, Mr. Brady, maybe the next Ways and Means chairman for all I know, and asked him for a hearing on this issue. In 3 weeks, he hasn't said a thing, and they're never going to say anything unless we put pressure on them.
Thank you, Jim, very much. The ranking member of the Labor, Health, and Human Services Education Appropriations Subcommittee and a leader on the whole issue of health care with jurisdiction over a number of the relevant agencies is our colleague Rosa DeLauro. Rosa?
Thank you very, very much, Lloyd, and want to recognize you for your leadership on this issue of reining in a high cost of prescription drug prices, and I'm proud to be a part of this task force. My other colleagues who are here today, so proud to join with them, because each of them has not just today, but for a very long time have played a role in looking at how we tackle this problem. We know all too well how grave the challenge is. As Congressman Doggett said, I am the senior Democrat on Labor, Health, and Education, the Appropriations Subcommittee. And today, I, along with the other Democrats on that subcommittee and with the ranking member of the full committee, Congresswoman Nita Lowey, we have sent a letter to Chairman Cole calling for a hearing on high prescription drug costs. Every single day, we see that the spiraling costs, what they do to vital programs under our jurisdiction, Medicare, Medicaid, the AIDS drug assistance programs. People all over this country are suffering, especially seniors and those who have serious conditions. And Big Pharma, as it's been pointed out, tries to justify the high prices by saying that they need to recoup their research and development costs for new drugs. But there is a worrying trend toward price gouging, even on drugs that have been around for years. And the most notorious example is Daraprim, a drug that was widely used to treat AIDS. In August, Turning Pharmaceuticals purchased the drug. Overnight, its price went from $13.50 a pill to $750. Daraprim is not a new drug, but there are no generic alternatives precisely because it used to be so affordable. The outrageous price hike puts life-saving drugs beyond the reach of those who need it most. Already, state of Georgia, the AIDS Drug Assistance Program has been forced to stop providing it. No doubt there are going to be more of these programs that are going to have to follow suit. Nor is Daraprim the only example of exorbitant pricing. My colleague Jan Schakowsky pointed out on the new hepatitis C drugs, the manufacturers have set a price for a single course of treatment for as much as it could go to $150,000. Last year, Medicare alone spent $4.5 billion on hepatitis C drugs. What does this translate into? Higher deductibles, out-of-pocket costs, increased burden on taxpayers. Certain state Medicaid programs have started rationing care to cope with this surge in costs. AIDS drug assistance programs are now unable to provide hepatitis C medications. And that is a break with their historic tradition of serving HIV patients with multiple chronic conditions. Implications for Medicare Part D, an analysis by Avalar, the 10 most popular plans, which represent 80% of enrollment, will increase premiums by an average of 8% in 2016 alone. This trend is expected to continue, driven by the high cost and the spiraling costs of specialty drugs. My colleague Jim McDermott pointed out pharmaceutical companies earning record profits. Patients and taxpayers pay higher and higher costs. BBC reported last year that in 2013, 5 pharmaceutical companies made a profit margin of 20% or more. These companies grow their business with the benefit of taxpayer-sponsored research. Then they turn around and they gouge the same taxpayers without whom the drug may not even exist. Let me just take a second. I have a personal experience. I first came here 25 years ago. I'm a survivor of ovarian cancer. One of the things I did immediately was I testified before a committee in the House of Representatives to support what was a public-private partnership, a CRADA agreement with Bristol-Myers Squibb to look at and develop the research on Taxol, which had the properties of being able to treat women in the late stages of ovarian cancer. I thought that this was what we ought to be doing, is putting this partnership together. And it also had properties for dealing with breast cancer. Lo and behold, what do I find out later? That hospitals could not include Taxol on their formularies because the price was too high. So that people who needed it couldn't get to it. And we had put public dollars, yes, with private dollars, to come to a conclusion to save lives. That's what this task force is all about. We urgently need to have these investigations that my colleagues are talking about here today. And I'm proud to be a part of this effort, and we look forward to making some changes. Thank you.
Thank you for your passion, as always, and your insight. Another founding member of our task force who has legislation pending on this issue and understands the impact it is having not on families but on our community hospitals is our colleague Peter Welch from Vermont, and a member of the Commerce Committee.
Thank you very much. It's wonderful to be here with my colleagues on this issue. You know, modern pharmaceutical medicine is a terrific thing. The pharma companies, in many cases, with what they make, are saving lives and relieving suffering. But they're killing the patients they save with the cost they charge. It isn't sustainable. It won't work. And it's not happening by accident. And it's not happening because the market requires these high prices. It is happening because the pharmaceutical companies have the marketing power, the pricing power to charge whatever it is they want. And that's got to end. There's got to be prescription drug price negotiation, as my colleagues have talked about. You know, you have a pill that was $7.64 dioxin, and then in 1 year it goes up to $572. That's not the market at work. That's a market failure, and it has enormous consequences for taxpayers. It has enormous consequences for patients. And it has enormous consequences to our ability to get access to help. Think about a patient or a family member of someone who has a serious illness, and they're told there is medicine out there that can alleviate suffering or extend life, but they can't afford it. And that's not a pharmaceutical industry that is serving the patients that depend on it. So what you've got here is a situation where the lack of any consumer protection, the lack of laws that restrict what all of us think is outrageous conduct, like that person who buys a company and a drug that costs $7 suddenly costs $7,000, that's a function of Congress not doing its job on behalf of the American people. And by the way, this is a bipartisan concern. It's not like it's just in blue states or red states that we have some folks with really serious illnesses. It's all of us being affected by it. And we've talked about a number of pieces of legislation here. We've got a bipartisan caucus, the Affordable Medicine Caucus. Keith Rothfuss is a leader of that, a Republican. Steve Stivers is the leader in trying to get fast generics approval that could save $2.6 billion. So our gathering here today is to send notice to the pharmaceutical companies that, you know what, the rip-off days are over. We salute you when you do research and come up with medications that extend life and alleviate suffering. We want to encourage that. We'll work with you on things that facilitate getting from the idea to the actual medication. But don't ask us to turn a blind eye to the punishing cost that you're inflicting on hardworking and vulnerable Americans. This has got to be sustainable. You're out of control. It's got to stop.
Thank you, Peter. Great. We're fortunate to have the senior woman, though I'm not sure she's a senior, in the House. Another appropriator who can have a big say in this, our friend Marcy Kaptur from Ohio.
Thank you, Lloyd, very much for your leadership this morning. Congressman Elijah Cummings, thank you for leading us in this effort. Congresswoman Schakowsky, Congresswoman DeLauro, Congressman Cicilline, and my dear friend Jim McDermott, Congressman Dr. McDermott, and obviously Peter Welch. Thank you. You are all so precious. I guess the advantage of being senior is that you have memory. And my memory is of, if you haven't lost it,
Not you.
my memory is of a former speaker of this House whose portrait was just taken down, holding the clock open until the wee hours of the morning, denying our ability to pass legislation to have competitive bidding in a free enterprise economy for prescription drugs. And I can remember the arms being twisted, and it was the most painful scene to watch. But that happened here. And it's amazing to me when polling's done across this country, and it's important to restate what others have said, 77% of the American people, regardless of partisanship, believe that the most important health priority we need to address is the rising costs of prescription drugs. That's really an astounding statistic. And all of us know when we go home and we stand somewhere, if 10 people come up to you, you know they're going to be talking to you about the rising cost of prescription drugs. A woman came up to me as I was taking my brother to the hospital for a checkup, and she said, Congresswoman, I am paying $700 a bottle for gout medicine. She said, and she was not a wealthy woman, by the way, and she said, I have epilepsy. I have compounding conditions that require me to take a certain type of medication. I simply can't afford it. I said, what do you do? She said, I only take it when I need it. I said, but with gout that doesn't work, because if you don't take it, you feel worse. But that's the predicament of people that I represent, and she's not alone in that. Dr. J.B. Silvers from Case Western University says the biggest spikes are with specialty drugs that are usually injected, and Jan talked about this in her remarks. He says the ones we've seen lately are existing drugs where somebody else buys the existing drug and then cranks up the price until somebody can come in and compete with them, and that's pure exploitation. Important widely prescribed drugs, including Humulin, RU500 to treat diabetes, and EpiPen for allergic reactions, have increased in price by 200% to 300% since 2007. According to the New York Times, the prices of some generic drugs have soared more than 1,000% in 1 year. And pharmaceutical companies enjoy some of the widest profits and the profit margins in the world, including more profits than the automotive industry. Now, one of the issues that's pending and really hanging in balance in this House right now is the omnibus appropriation bill that is being conferenced. Hopefully we'll be able to get it passed, but it includes an amendment I was able to get included in our bill for 2016. It was passed on June 24th, and it directs the Secretary of Health and Human Services and the VA Secretary to report within 120 days of the bill's enactment with an analysis of prescription drug price increases, to review how the federal government has achieved competitive cost reductions for drugs since 2001. It focuses on the 10 most frequently prescribed drugs and the 10 highest cost drugs under Medicare Parts B and D, Medicare, and the VA. And it asks them to compare those prices to Canada, Mexico, and other countries where appropriate. The analysis can be used to identify possible cost savings through collective bidding and bulk price negotiation. And I want to say that it was accepted by the Republican majority on a bipartisan basis, and one of only 3 amendments proposed by Democrats that were accepted by the Republicans out of a total of 30 that were offered. So, as this bill moves to conference, we want to make sure that language stays in there. We have an opportunity to really help the American people. It's our responsibility to do so, and I am so proud of this task force, and I'm proud to stand with all of you. Thank you.
Thank you for your leadership on that, Marcy. That's great. I'd like to call on our colleague from Rhode Island, the articulate David Cicilline.
Thank you. Good morning. I first want to thank Congressman Doggett and Congressman Cummings for organizing this task force. I'm proud to be part of it, and thank all of my colleagues who have worked on this issue for a very long time. As has been repeated, I think the United States pays more per capita than any other country in the world for prescription drugs, and these costs continue to rise. Last year, we've heard some examples of egregious instances where prices have gone up by 1,000%, 500%. But in addition to that, last year one study found that increases for all drugs had gone up over 10%, and that families were being forced to cover those costs out of pocket or go without those prescription drugs. This is an issue which affects every single family almost in this country. And certainly in my state, in the state of Rhode Island, we have more than 80,000 seniors who are really impacted by this. Just last week, I met with Cecile, a woman in my district who's in her early 80s, and she described for me that she gets a written prescription from her doctor rather than having called it into a pharmacy, because she spends the first couple of days on the telephone calling every pharmacy in Rhode Island to find the cheapest price so she can afford it, and then she has to make arrangements to get transportation to try to get to that pharmacy, or she can't take her medication. This is America. That should not happen, and it's happening because pharmaceutical companies are gouging all Americans on these prices. Seniors who, by the way, just learned last month that they will not receive a cost of living adjustment for Social Security, and next year their drug coverage as part of Medicare Part D are projected to increase by 13%. This is completely unsustainable. And as has been mentioned, this isn't just happening because the market is requiring it. It's happening because the market has been rigged for the pharmaceutical companies. We're not allowed to negotiate discounted prices. There's legislation to ensure that that in fact can happen, which will produce billions of dollars in benefits to the taxpayers and to people who are using prescription drugs. And this is not only an issue which is important to seniors, but it's really important to young people, to families, to people of all ages. And in Rhode Island, for example, I know this is happening in many states, we're dealing with a very serious public health crisis that relates to heroin and opiate abuse. And if you look at the number of people that are now being infected with hepatitis C, the numbers are growing. There are over 3 million Americans who are living with hepatitis C today. And 50% of all IV drug users will be infected within the next 3 years. So this is a public health crisis. Hepatitis C, as you know, can lead to liver failure, cancer, and death. It kills thousands of Americans every year. And that does not have to happen. When treated properly, it's completely curable. But the cure costs, as was mentioned, $84,000 for a 12-week course. That's $1,000 a pill. And very few people can afford to pay for that kind of prescription. And in Rhode Island, 65% of all Medicaid requests have been denied because of the cost to taxpayers. And so those individuals who could get that treatment and live a productive and healthy life are denied access to a healthy life. It should not be that way. And in the richest, most powerful country in the world, no one should suffer because they can't afford a life-saving drug. This task force will address that. This is a crisis in this country. We know the answers. We know how to fix it. And I look forward to working with my colleagues to make sure we do just that.
Thank you, David. Over a year ago, Our last speaker and our concluding, before answering any questions you might have, was already at work on this, requesting reports, requesting hearings, seeking a subpoena of one of these pharmaceutical leaders. I'm very pleased to be working with all my colleagues, but especially with the ranking member of the Government Reform and Oversight Committee, Elijah Cummings of Baltimore.
Thank you very much. Thank you, Congressman Doggett. Before I get started, I want to thank all of my colleagues for being here this morning and being a part of this very important effort. One of the things that, as Congressman Cicilline was talking, what he didn't get to, and with his eloquent speech, was that if the people are not able to afford the prescriptions, that means they suffer, and in some instances they die. Suffer and die. I said yesterday to our caucus that the failure to address these issues with regard to the skyrocketing prices of drugs, the failure would be legislative malpractice. We have no choice but to deal with this. And so we're here today because we need action, and we need action right now. Prescription drug prices are skyrocketing, and the American people are simply fed up. But Republicans have repeatedly refused our request to do anything about this issue. Not a single letter, not a single hearing. Just last week, the nonpartisan Kaiser Family Foundation, I know we've talked about this before, found this to be the #1 health issue for all Americans. And an interesting finding there was that even among Republicans, it was the #1 health issue, replacing the repeal of the Affordable Care Act. That's major stuff. Among this is, again, it was bigger than Obamacare. And let me show you a picture of Michael Pearson, the CEO of Valiant Pharmaceuticals. We want him to come up. We want you to see his face. You got to see his face.
He's happy.
He has become a billionaire in part by purchasing old, reasonably priced drugs that have little or no competition and then increasing their prices exponentially, sometimes overnight. He then reaps the financial gains for himself and his shareholders rather than reinvesting funds into research and development for safer and more effective medications. For example, Isoprel is used to treat abnormal heart rhythm. Mr. Pearson's company, this guy right here, bought this drug in February and increased the price from $215 to $1,046, 525%, and he did it overnight. He did it overnight. Another drug, Nitropress, is used to treat congestive heart failure. This guy right here, Mr. Pearson, Mr. Pearson's company bought this drug and on the same day increased the price from $257 to $805. Come on, we're better than this. Let me show you another CEO. Where's my man Martin?
He's here.
Oh, there he is. This is the famous Martin Shkreli, a 32-year-old former hedge fund manager who now runs Turing Pharmaceuticals. He used this exact same business model to buy Daraprim, which treats life-threatening infections in patients with suppressed immune systems, such as pregnant women and patients with HIV/AIDS and cancer. He then increased the price from about $14 per tablet, listen to this one, to $750 per tablet overnight. Overnight. This is an increase of 5,000%. He promised several weeks ago that he was going to reduce the price and has done nothing but hire a whole army of lobbyists to, I guess, keep the price at $750 per tablet. He called the price gouging, and I quote, a great thing for society. I don't know where he got that from. I've been trying to get my Republican colleagues to focus on this issue for the past year. In fact, I started investigating Valiant last spring. We asked Republicans to join us in investigating these companies engaging in price gouging. We asked them to send document requests with us. We asked them to hold hearings. But every time they said no, 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 and no. I believe this is unconscionable, and frankly, it's inexplicable. Patients, hospitals, and healthcare providers in all of our districts are affected by this price gouging. It's one somebody just said a minute ago, this is not a Democratic issue. This is not a Republican issue. This is an American issue. We want to keep our constituents well, and we don't only want them to be able to get the treatment. We want them to be able to get the cure. See, you can get the treatment, but if you can't get the cure, you can't get the medicine, you're in trouble. But Republicans do not want to act. So today, all the Democrats on the Oversight Committee sent a letter to our chairman. We asked him to schedule a hearing with these two CEOs, and we asked for subpoenas to get the documents these CEOs are withholding from Congress. And in our letter, we also said, if the Republicans don't want to join us, then get out of our way and let us do it so that we can protect all of our constituents, both Republican, Democrat, Independent, and Tea Party. Let us have our vote on subpoenas. Let us do the investigations they refuse to do. And again, I want to thank all of my colleagues because this is so very, very important. We can make a difference. And my last thing, a lot of times, a lot of people will look and they'll say, well, you can't make a difference. I'm telling you, we don't have the right to remain silent. And we will deal with this issue until we get it resolved, because the life of Americans depend upon it. Thank you very much.
Thank you, Elijah, very much for your leadership. Questions? Yes, ma'am. Well, there are some investigations going on at the state level already, I believe. That's good to hear of their action in the Senate. I knew they were doing some investigation, but to hear that they finally scheduled hearings, I hope that will set an example for our colleagues here in the House. I would say first and foremost, we hope to elevate the attention among policymakers to the level that people across the country have, that this ought to be a top healthcare concern instead of worrying about whether to do a 62nd or 65th or 72nd or whatever it is repeal of Obamacare, to focus on something that makes a difference in people's lives. Second, as I mentioned initially, to continue to encourage the administration. It is restricted by the statutory language that was mentioned when Part D was passed. But that language is rather confusing, and I think the administration has some discretion within not only that statute but others to act, particularly with relation to some of the disclosure issues, some of the transparency issues in this regard. And third, we hope to push specific legislation, just as Representative Kaptur mentioned, to get this information out there. We're pleased that both Hillary Clinton and Bernie Sanders have outlined some proposals on this, and we plan to carry this message not just with action here in Washington. We'll have our own hearings if we can't get hearings with the Republicans, but to other parts of the country as well. You want to?
Yeah, go ahead.
Sure.
Okay. Shaming is important as well.
That's right.
And by elevating this issue and pointing out what these drug companies are doing, we know that 1 out of 4 households in America, someone could not afford to fill a doctor-prescribed prescription due to the cost. So this is going to resonate with the American people, and I think that drug companies will be shamed into responding. And the other thing is just getting the information. We don't know how much is spent by the United States taxpayers doing research and development as opposed to what the pharmaceutical companies say that they're spending, that without the money that they charge, they couldn't do the research and development. We think that that is not accurate, and we need to get the data.
Let me just say this, 3 things. One, already we have elevated this issue, and not only has Bernie Sanders and Hillary Clinton put out proposals, but one of the interesting things happened even in the last Republican debate. There was finally a question about prescription drugs, finally, and it was asked to Governor Christie. I wasn't impressed with his answer, but it was asked. Number 2, I have to compliment the New York Times. They have been following this issue very carefully, and it is interesting how while we all believe that companies should make a profit, we just don't want them to be gouging people. But in the Times, they show where the Valiant stock has been going down because people are becoming much more aware of the tricks that have been being played so far. And finally, as I said before, we have no choice but to stand up with regard to these issues. In a meeting with Attorney General Loretta Lynch about 2 months ago, I told her, I said, as far as I'm concerned, this is a #1 issue that I wanted her to look into. And I said it's the #1 issue because my constituents are dying. They are dying because they cannot get the cure. And so there's a sense of urgency. And I think and there's no doubt about it, everybody up here, and there are others that maybe could not be here, members, we have a passion for this issue. And I believe that our passion will be contagious, and that other members will join, and hopefully, and by the way, there's one last thing. I've had so many Republicans to come up to me, Republican members, and say, you know, when are you all going to do something about prescription drugs? I said, well, why don't you get Chavis to help us? Why don't you get your own party? And they're complaining about the cost of prescription drugs in their own districts. And now I'm hoping that with our new speaker, he'll step up to the plate, show some leadership, and address this issue.
I suppose, let me just say this. I talked about my own circumstances. I'm here today by virtue of the grace of God and by biomedical research. So I understand very, very well the value of biomedical research and what its ability is to save lives. But people people in the country should not die because they could not afford to get a drug that could save their lives. That's not who we are. It's not by what area of the country you're from, by what hospital you go to, what's on the formulary of that hospital. It is the ability of biomedical research. What is its goal? Is to save people's lives, and getting access to that medicine is what we are in the business. In this institution, we have the power to make it possible for people to get access to life-saving drugs.
Other queries? Well, thank you very much. We'll remain for a few minutes and really appreciate your being here with us on this critical issue.
Thank you.
Thank you, Elijah.
Thank you.
Thank you.
Beautiful.
Thank you, Rosa. I didn't know your story.
Yeah.